Hi everyone, my name is Benoit Glazer. I am a conductor and the artistic director of the Timucua Arts Foundation. I am here today with my lovely daughter, Dr. Camille Glazer, which is rare. And it's rare because she lives right now in Liverpool. I had to take this opportunity to talk to her about her experience. She battled acute myeloid leukemia in the spring of 2019. I want her to tell me everything.
So I have a bit of an unusual diagnosis story. I had just gone out to Thailand to do a 2-week externship, not a very long trip at all. And a few days in, I developed quite a high fever, and I was in quite a lot of bone pain from that fever. So when it didn't resolve for a couple days, I decided to go get tested for dengue, because that was my primary concern, or possibly malaria. So I went to the hospital and they drew some blood to run those tests. And by pure chance, the doctor I had seen in the emergency department was a hematologist, and she ordered a complete blood count just as part of the blood test she ordered. And on that, they identified that my blood counts were extremely abnormal. So they held me overnight, did a bone marrow biopsy in the morning, and diagnosed me with leukemia. It's not the diagnosis you expect 4 days into a trip to Thailand, but yeah, that's how it began.
And I can tell you that that phone call was tough.
Yeah.
I'm sure for you and for us, definitely.
The diagnosis was confirmed in the morning, and I think that afternoon I had a bag of chemo hanging.
You had access to more cutting edge treatment at your your second to last chemo treatment. Tell us a little bit about that.
Yeah, when I arrived back in the UK, because I was a young blood cancer patient, they were able to enroll me in part of a clinical trial. Not the whole trial, because I had already had my induction chemo somewhere else, but I was able to get an experimental drug, which basically just binds to the cancer cells and makes chemo more able to attack those cells. So I received that prior to my second round of chemo. And I achieved remission after that treatment. The further cycles were just to make sure that it stayed that way. But yeah, I was really lucky in that sense.
And that's just to kind of, from my point of view, is to demonstrate the value of research in that field. I never quite realized that the adverse effects of the treatment. I always thought the disease was causing all of that.
I think something that my doctors made very clear to me when I was diagnosed is that the cancer will kill you. Leukemia, especially acute leukemia, will kill you, and very quickly. But the treatment can also kill you, unfortunately, and that does happen to an unfortunate number of people. But the treatment is also what causes a lot of toxicities. In the case of leukemia, it's not necessarily the cancer that causes things like loss of function or later long-term side effects. It's the chemo that does that. Chemo is obviously a very potent and toxic drug in and of itself. It doesn't only affect your cancer cells, it affects all of your healthy cells. It's not just hair loss that it causes. It can cause things that affect you for the rest of your life. Hearing and vision changes in the function of your organs that you may need to protect forever.
And any lasting effects of the treatment?
Yeah, definitely. I've got loads. I'm in early menopause from the chemo, which is very common, and I think particularly for blood cancers, it is often a crash diagnosis, especially with acute leukemias, where you don't have time to do things like freeze eggs or do any kind of procedures prior to starting chemo. So that's something that's obviously going to be with me forever. I also developed some toxicities to the chemo, so I lost most of the hearing in my right ear, my vision changed. I developed a resistance to random donor blood, so I have to have specially donated blood if and when that's ever required throughout my life. Loads of effects. I'm at increased rates of blood clots forever. There's lots of long effects and late effects of chemo that I'm still dealing with.
Luck had a lot to do with in your case.
Yep.
You were lucky at very many instances within, your treatment. And I don't think that's right. I think that luck shouldn't figure into whether you survive or not a disease. I think that we should have a treatment that works for every patient, and that or most of the patient, and where luck would have little or nothing to do with the outcome. So of course we're blessed, we're happy that you were lucky, but at the same time, I want other parents of other young blood cancer patients to not have to be lucky, and for their kids to survive and thrive.
Yeah, I think something that people sometimes forget is with blood cancers, leukemias, there's nothing to cut out. You can't have your, everything drained from you and replaced. So that's why it requires such intensive chemotherapy compared to other cancers, and why the treatments are so harsh and can be so difficult to survive in and of themselves. So I think any advances we make towards the drugs that are available, any complementary conjunctive treatments that we can develop will absolutely make a difference. In my case, I was 23, and so these long-term side effects are going to affect me for the rest of my life, which is hopefully a long time. So it is quite a brutal treatment. Again, I wouldn't have refused the treatment because I knew what the circumstance was if I did that. But it is very hard to live with. It certainly can be.
It's important to find better treatments.
Yeah.
I mean, from my point of view, let no one have their kids go through that ever. So let's find a better treatment, guys.
Yeah, I think we can do it.
Think.